Hi viewers, this is Dr. Iftikhar Islam from Pakistan. Today I'm going to present my lecture on tularemia, which is also known as rabbit fever, deer fly fever, O'Hara's disease, and Francis disease. In today's lecture, we will cover the information regarding the organism that causes tularemia. We will also talk about the history of the disease, how it is transmitted, species it affects, including humans, and clinical signs observed. Finally, we will address the prevention and control measures for tularemia, as well as the actions to take if tularemia is suspected. Tularemia is caused by Francisella tularensis, a gram-negative, non-spore-forming intracellular pathogen. The bacterium multiplies within macrophages, and the major target organs are lymph nodes, lungs, spleen, liver, and kidney. The organism is relatively resistant in the environment, surviving 3 to 4 months in the mud, water, or dead animals. Rabbit meat frozen at 5 degrees Fahrenheit has remained infective for more than 3 years. Chlorination of water during water treatment will kill the organism. The organism is easily killed by various disinfectants, including 1% hypochlorite, 70% ethanol, glutaraldehyde, and formaldehyde. It can also be inactivated by the moist heat. The largest recorded airborne tularemia outbreak occurred in Sweden in 1966 to 1967. Over 600 patients were infected with type B. Most of those infected were exposed while doing farm work that created contaminated aerosol, particularly when rodent infested hay was being sorted and moved from field storage sites to the barns. Most had typical acute symptoms of fever, fatigue, chills, headache, and malaise. Only 10% had symptoms of pneumonia, such as dyspnea and chest pains. Other forms of tularemia were noted in variable portions of patients. 32% had various skin exanthemas, 31% had pharyngitis, 26% had conjunctivitis, and 9% had oral ulcers. Patients responded well to the treatment and no deaths were reported. There are many known reservoirs, at least 14 species of ticks, 6 species of flies, several mosquito species, over 100 wild mammal species, and 25 species of birds. Ticks and rabbits are the source of most human cases in the United States. A rodent mosquito cycle has been described in Russia and Sweden. People can become infected by as many as 10 organisms via the inoculation or inhalational route, but require a larger dose. The severity of the infection and incubation period in humans varies depending on the subspecies, route of infection, and the dose. There are 6 clinical syndromes or manifestations of tularemia based on the route of exposure to the agent. All forms initially present with the flu-like symptoms, including fever, chills, headache, and myalgia. In these pictures, you can see the ulcers and ulceroglandular lesions of tularemia. Tularemia has resulted in high mortality outbreaks in sheep in exotic areas like in Canada and in some states of United States of America. Clinical signs reported include fever, weight loss, regional lymphadenopathy, and diarrhea. Ill animals will also separate themselves from the flock, have a rigid gait, and may have respiratory difficulty. Death most commonly occurs among young animals, but pregnant ewes may abort. Horses have been occasionally reported to be infected with tularemia. Symptoms reported have included fever, depression, dyspnea, ataxia, stiffness, lack of coordination, and limb edema. In these cases, the horses were parasitized by a large number of ticks. Infected young swine suffer from fever, dyspnea, and depression, while the disease in adults become latent. Cattle seem to be resistant to developing clinical disease. Tularemia in cats can range from non-clinical infection to mild illness with lymphadenopathy to severe infection and death. Signs seen in reported cases include fever, depression, anorexia, listlessness, and apathy. And some cases had an ulcerated tongue and palate. Dogs are considered relatively resistant to the tularemia. When acquired, it is typically through the ingestion of an infected rodent. Signs reported include fever, ocular and nasal discharge, abscesses at the site of infection, uveitis, and conjunctivitis. Treatment for the animal species is typically supportive when clinical disease develops. Streptomycin is the antibiotic of choice, but tetracycline and chloramphenicol may be used alternatively, as some strains may be streptomycin resistant. Removal of ticks from infected animals may also help prevent further transmission of the disease. Proper removal techniques should be used and antiseptic applied to the site following removal. One of the best preventive steps in avoidance of tularemia outbreaks is education. This is especially important in areas where the tularemia is endemic. Personal protective equipment such as gloves, masks should be worn when working with potentially infected animal tissues, such as skinning rabbits, necropsy, or reservoir species. Meat from potential reservoir species, such as rabbits, rodents, should be thoroughly cooked. Well, that's the end of our today's lecture. Thank you so much.